The year 2020 was tough for Kenya after the first COVID-19 case was announced on 13th of March. The education sector was shaken, schools were closed, businesses collapsed, and lives were lost. It's 1 year down the lane, and the heat of the pandemic can still be felt. Up to date, the country has recorded about 112,000 cases of COVID-19. Our own reporter Lillian Mukiri has more on this tonight on COVID at 1.
On the 13th of March 2020, the Ministry of Health announced the first COVID-19 case, which was from a Kenyan who had traveled back into the country from the US via London and the UK. The test was done at the National Influenza Center lab, and the patient was put under treatment at the Kenyatta National Hospital.
The case was confirmed on the 12th, which was last night, as the first one to be reported in Kenya since the beginning of the outbreak in China. The case is a Kenyan citizen who traveled back to Nairobi, returning from the United States of America via London, United Kingdom, on the 5th of March 2020. She was confirmed positive by the National Influenza Center Laboratory at the National Public Health Laboratories of the Ministry of Health.
On 15th March, President Uhuru Kenyatta, on his national address, issued a number of restriction measures in order to combat the spread of COVID-19 in the country. Among the measures included closure of schools by 20th of March, countrywide curfew, closure of clubs, restaurants and non-essential businesses, suspension of international flights, partial lockdowns in Nairobi,